Hey y'all, good morning. So I'm probably going to be having a few videos today, so definitely turn your notifications on. So let me back up. Welcome into the channel. How are y'all doing? My name is Tommy. This is Tommy Rice TV Homestead. I'm doing gardening over here. I know I haven't really been showing y'all a lot, but I'm going to show y'all some stuff. Anyway, I also cover news over here as well, and preparedness. So we all should be prepared. We should prep today so we're prepared for whatever tomorrow brings. That being said, it could bring health issues, health dangers. There has been a public health emergency that has been issued in this state, and it's affecting the little ones, the most vulnerable of them all outside of elderly. So I'm in here. I was working out and I was like, let me see what's out here first of all. And if there is something out here, I want to bring it to you guys. So I stopped my workout, but before I get into the story, y'all, I have an update. I share over on my other channel though, so follow me for that journey over there. My glasses on because I can't hardly see. So I do over there, but this is a little sweat vest. This is what I'm looking like right now. So anywho, let's get into the news that hopefully you can use. Health officials have declared a public health emergency after releasing data showing the state's infant mortality rate has risen to its highest level in more than a decade. And that is insane in 2025 for that to even exist. But in the state of Mississippi, this is what's happening. Mississippi health officials have declared a public health emergency after releasing this data. In Mississippi, 9.7 infants died for every 1,000 live births in 2024, and nearly double the most recent national average of 5.6 deaths per 1,000, according to the State Department of Health. Since 2014, more than 3,500 Mississippi infants have died before their first birthday. I don't know what's happening. I don't know if it's the education part of it, or it's younger adults having babies and not knowing. I don't know. The decision to declare a public health emergency places Mississippi's struggle within a wider national story. So this is a nationwide thing, but it's definitely, higher in Mississippi, they're saying. So in Boston, the city's most recent report showed Black infants dying at more than twice the rate of overall population and triple the rate of white infants, despite the city's overall infant mortality rate falling below the national average. Public health experts say both examples underscore the limits of focusing on individual behavior. Clinical care, when structuring inequities, are key drivers of infant death. Every single infant lost represents a family devastated, a community impacted, and a future cut short. They announced this Mississippi declaration. They say we cannot and will not accept these numbers as our reality, but reality is this. It is what it is, and hopefully they can bring those numbers down. The leading cause of infant death in Mississippi include congenital malformations, premature birth, low birth weight, sudden infant death syndrome, SIDS. They also say despite growing concerns, declaring a public health emergency for infant mortality is unusual. This is a novel and necessary step, says the chief medical and health officer at March of Dimes. It evaluates infant mortality to the level of urgent crisis response in care. Their plan includes expanding prenatal services in counties without obstetric providers, creating an obstetric system of care to regionalize services and improve emergency transfers, and strengthening home visiting and community health worker programs. Improving maternal health is the best way to reduce the infant mortality. Yes, it boils down to more resources being available in certain areas than others in Mississippi. And so I don't know where that money's going to come from, but hopefully they will get that all figured out, because no one should experience the loss of a child. So hopefully they are going to find the funds for this, maybe get grants or whatever, so that they can improve the maternal health and reduce the infant deaths. So just a little bit of news that you can use, and I will see you guys in the next video. Y'all take care and stay safe. Don't forget to hit that like, share the video out, subscribe if you have not, for all the news that you can use, not just related to preparedness. If something's going on, then we are going to talk about it if I know about it. And if I feel like, it needs to be out there, then I'm going to share it with you guys. So I hope you appreciate that kind of content and subscribe to the channel. Bye, y'all.
Here's to the good days. Here's to the sorrows. If this is a mistake, I know about tomorrow.